Bismillahirrahmanirrahim. I am Dr. Javed Iqbal Kokar, Professor of Forensic Medicine. As I've started discussion on the wound production, traumatology, or mechanical injuries, and this is the second lecture of today. And the contents of the today's talk will be I will discussing what are various other factors. We have started discussion the intrinsic qualities within the weapon, then the factors which are responsible in the causation of the wound production or change in the appearance. Then what is the uh, wound, weapon, tissue, force and movement effect. So that is the force and movement effect. And what are weapons intrinsic qualities, force how much it is applied, and the force applied can be under various physical laws, and we'll discuss those physical laws. Then tissue, because there is human body is made up of different type of tissue, so every tissue will behave different according to the architectural design, contact area and the target area. Contact area is different and target area is different. We'll explain that. So starting with the discussion, what are the factors which are responsible with the change in appearance of the wound, and how they change the appearance of the wound. They are basically the factors which are the qualities, intrinsic qualities within the weapon and other factors. So besides intrinsic quality of the weapon, which we discussed in the previous lecture, the amount of force applied, the architectural design of the tissue, they change the appearance of the wound. So the intrinsic quality of the weapon we have discussed. Now the application of force. The role of force is very important. The amount of force used for the causation of injury, that is basically responsible for change in appearance. For example, there is always a response and a counter response. When we apply a force, there is a response and counter response. And response is the force applied, and the counter response is in the shape of the trauma. Then the interaction between the tissue and the force. So two factors, the tissue and the force, there is interaction, and they are governed by laws of the physics, and those laws are basically the physical laws which are related with causation of wound protection. So that's why we should understand them. Like the Newton's law of motion, laws of elasticity, laws of conservation of energy, and Hooke's laws. So these physical laws, we will try to understand how they play their role in the causation of trauma. Because when a force is applied to a mass, the mass reacts in two ways. Either the mass will resist the force, and this resistance is due to its own elastic properties. That means he, under the property of elasticity, he will resist. They will, tissue cells will move, try to adjust, try to absorb the energy under the law of resistance, law of elasticity. So the mass will try to adopt the force or absorb the energy, resulting in distortion of the mass. And human body, we know that it is not a uniformly structured. It consists of various types of tissues, and there are cells which are arranged in a specific order. And whenever a force is applied to the body tissue, its constituent cells, which are in layered, these cellular elements are set into motion, and they are displaced from its original position. And this movement of elastic force arises. So when they move, there is a force of elasticity that is created within the tissue, and which will try to bring back the cells to original position. And this is law of elasticity, that when the force will try to distort, the cells will move and the elastic properties within the tissue will try to bring the cells back into original position. They are laws of elasticity. So, the laws of elasticity, it states that the amount of force required to return a distorted mass back to its original position is directly proportional to amount of distortion. And when a force exceeds that elastic limit of the tissue, then the tissue disrupts, and then the trauma or the break in the continuity occurs. So when the force of impact exceeds the capacity of tissue to resist or to adapt, they are torn and the wound is produced. And this is the Hooke's law. Now, the amount of force. The amount of force in the causation of wound is very, very important because it changes the appearance of the wound. For example, if we use a stick on the same point of the body, with very little force, a simple erythema will occur. And if we increase the force, it can cause a lacerated wound. And if we further increase the force, it may cause fracture of the bone underneath. Or with more increase in force, it can simply crush. So, with the same weapon and the same site, just by increasing the weight, increasing the force, application of force, the wound, the appearance of the wound is changed. Now the velocity of force, speed. This is very important because when an object is moving at definitive speed, a mass having a mass will be having a definite force or energy. That means when any object it moves, it has got in mass in it, then the force with is moving, that is represented as a directly proportional to half the mass and square root of the velocity. So the force in moving object will be half the mass but square root of the velocity. So simply by increasing the velocity you can produce enormous force. So that's how the bullets act. So it means force is directly proportional to half the mass and it is square root of the velocity. And that is why a bullet manifests enormous damage instead of a brick. Brick is having much larger mass than a bullet, but when it is moved, its velocity is much lower than the bullet. Bullet having a small mass but enormous velocity, enormous speed produces abundant or enormous damage. Now the contact area, the area where the force is being contacted, that means the tissue or the subject. The subject or the contact area in the causation of wound, how it plays its role. The contact with the tissue is very important factor in the wound production because every tissue, every body component has different characteristic. So until unless there is a contact between the subject and the object on the body, the wound cannot be produced. So contact means the area of contact where the wound is produced. So some point must be taken into consideration, the area factor, that is where it is going to strike. Target factor, what is the target? Target factor is the same or it is something remote. Then moving of the target where it is striking is fixed, not moving, or the person or the target is moving. So the area factor, the wound will depend upon the amount of energy liberated or transferred to the area of tissues and the rate at which the energy is transferred and the site of target area. So that means the appearance of the wound will be depending upon the amount of energy, amount of force which is used at a particular place where the force is being applied. So the amount of energy liberated and the target area, they are the important factors and they change the appearance of the wound. So energy transfer is directly proportional to severity of the wound. That means if the energy transferred is much more, the damage will be more. Similarly, the size factor, if the size is broader, it will be inversely proportional. That if the broader is the size, the amount of energy dissipated per unit area will be less. And if the target area is small, then the transfer of energy, transfer of force at a particular place will be more than the broader surface. So higher the amount of energy transferred and smaller the area of impact, the damage will be much more. The wound will be much severe in nature. Now, target area, which is the target factor, target area. Target is the point where the maximum concentration of force or energy where the wound is produced. So that is target area. So target area is that point where there is maximum concentration of the force which is being applied, and there will be the maximum wound production. I'll explain this with some example. Sometimes the local damage at the site of impact is less or minimal, but the energy is concentrated at a site which is away from the point of impact, like jumping from the height. If someone is jumping from the height, the energy is transferred through the legs to the vertebral column to the base of the skull where the energy is maximally concentrated. And there will be fracture of the base of the skull, which is much remote than the area of impact. Area of impact, they are feet or the heels, but the force is being transmitted from the legs to the vertebral column to the base of the skull. So the area of impact is the feet, but the area of maximum concentration of force is the base of the skull, which will be causing the fracture of the base of the skull. There is another example in road traffic accident when the driver is sitting on the front and he is applying brakes. The impact will be concentration of the force at the hip and the pelvis. When the driver is applying brakes through the feet, through the legs, the force is being concentrated at the pelvis, and there will be appearance of fracture of the pelvis. And driver is also holding the steering column, and through the hands, arms, the force is being transmitted to the shoulders, and there will be damage to the shoulder joint. So this is how the force is being transmitted from the feet to through the legs to the pelvis, and from the hands through arms to the shoulders. And the other co-passenger who is not having a steering column, he is not holding the steering column, he will be taking support of the dashboard. The force is transmitted from the arms to the shoulders. Now, when we talk about the movement of the target, that the person is fixed or free to move, there are certain situations in which the body is either free to move or fixed. When it is free to move, in this situation the local damage will be less because part of the force will be dissipated in the movement, body movement. Body will be more move in the other direction, and only a fraction of force will be available for the causation of the damage. Like road traffic accidents. But when the body is supported, that means the body is fixed, not able to move. He is supported like lying on the floor, standing against the wall. Then the whole energy, when it is dissipated to the body is not free to move. Then the damage is much severe because all the force is utilized in the production of the wound. Like in road traffic accident, if the body is supported by the belt, it causes maximum local damage. If a moving object hits a stationary part of the body, when a moving object strikes the stationary part like the skull, then the local damage is much more. Now, moving body part strikes a stationary place. Now the body is moving and he is striking to the stationary place. Classical example of this is when the head strikes to the dashboard or the windscreen. As the bony skull inside contain membranes, brain in the cerebrospinal fluid, and there is sudden obstruction of the moving head. Head is moving and there is sudden obstruction. The contents within the skull, they are still moving, and this will lead to the concentration of force at the point of strike. When the moving head will be striking to the windscreen or the dashboard, there will be concentration of the force if the forehead is striking at the forehead, because inside contents brain cerebrospinal that are moving and they are concentrating at the point of impact. And inside brain, due to compression against the skull, will be having co-injury. So if the moving head strikes a stationary dashboard or windscreen at the point of impact, there is concentration of the uh, contents, and that will be causing co-injury. Exactly opposite to the forehead is the occiput. Exactly opposite, there is a negative force because the internal contents are moving forward, and from the posterior side the contents are being avulsed, having a negative pressure like this, and they are called as contra co-injury. The contents of the brain will be avulsed from the opposite side of the impact, and that is contra co-injury. At the point of impact is coup, and opposite to that is contra coup. Now when we talk about the subject, the tissues where the force is being dissipated, the response of various body tissue, we know the architectural design of various tissues is different, they will behave differently. The subject is the body tissue and they are having different architectural designs, and there are cavities. Cavities have covering and there are contents within the cavities, and the contents may be solid, hard tissues or the soft tissues, and the covering can be the hard covering or the soft covering, and these contents can also be fluids or the gas, the air. So the target tissues, they are composed of skin, subcutaneous tissues, fat, muscles, bone and cavities. So all you know, they have different design, different cells, different elastic and plastic qualities. So they will behave differently. So each tissue has got its own characters, which makes it difficult to predict about the wound production. How it behaves, it depends upon the amount of energy, amount of type, area involved. So when we talk about the skin has got elastic as well as plastic properties due to firm cohesion between the layers of the keratinized cells. The cells are they are firmly adhered together, and this allows the skin to resist the force and escape the damage, while the underlying tissue may be severely damaged. but skin may also get damaged with severe injuries. Now the subcutaneous tissues and the fat, subcutaneous tissue and fat, they provide a cushion effect and the body gets protected, the underlying tissue gets protected by the subcutaneous fat and the tissues. But when a blunt force is applied, the skin may escape damage, but the fat and the subcutaneous tissue, they may disrupt. And this will cause also the disruption of the vessels and the subcutaneous tissues, and that will be causing bruise. A bruise will then appear in the areas where the subcutaneous vessels are ruptured. Fat have also both elastic and the plastic properties. Now, when we talk about the muscles, in addition to elastic and the plastic properties, they have another advantage of being encapsulated. We know that the muscle fiber, they are encapsulated, they have got a capsule which provide them a more protection than the other tissues. So therefore, they may sometimes escape damage by the blunt force. But if the amount of blunt force is so much that it causes fracture of the bone, then the muscle damage will also be there. Now the bones. The bones have got only the elastic properties. And when a force is applied to the bone within its elastic limit, it will recoil back to in its original position. But when the force exceeds its elastic limit, then the bone will be fractured. And this will be either direct fracture at the point of maximum convexity where the force is applied. And in some instances, the force of concentration is at some other point, and that will be causing the indirect fractures. When a spiral force is applied, then the spiral fractures will be appearing. When the impact force is applied, then it will cause the impact fractures. Now, regarding the cavities, the hollow viscera of the body, we know that they contain fluid and they contain gases. The fluids are incompressible, but they can be displaced when the force is applied. And these hydrostatic forces will be generated which acts radially and in all directions and displaces the fluid. So damage will be seen at the distant place, far away from the site of application of the force. When the force is applied to a viscera containing air, there will be powerful pneumatic forces which will be produced, and they will also be traveling radially in all directions and will produce damage at a distant site. Like in traumatic asphyxia, the compression is applied to the chest in stampede or other traumatic, when the debris is falling on the chest in the falling building, then the chest is compressed in traumatic asphyxia, but the petechial hemorrhage will be appearing on the face and eyes. In eyes, sometimes subconjunctival hemorrhages can be seen. Okay, these are hemorrhages. In blast injury, similar hydrostatic pressure and pneumatic pressure forces, they are produced and they cause laceration of the lungs, heart and other structures. Then, although there is no contact in the blast injuries, as I already told in the previous lecture, that there is no contact in the blast injuries, but even then the damage occurs. So thank you very much. This is all about the second lecture. We'll continue the topic in the next lecture. Take care. Allah.